Bismillah ar-Rahman ar-Rahim. I'm Dr. Zaman. Today we are going to talk about the OET listening part. So, how to start up your preparation for this section of the exam. Again, this is very easy but needs some guidance and tips, and for this, I am making this video. So, let's start up. Remember, there are three parts of this section of the OET exam: A, B, and C. How to prepare yourself for the OET listening section. Remember, go to the OET website. Again, there are 5 simple papers for each specialty like medicine, nursing, physiotherapy, and others. Go and practice 2 papers out of the 5 simple paper. Rectify your mistakes. Come back and practice number 3. Again, work on your mistake. If you are improving, so it means you are going in the right direction. What you need to do after that, go and practice 3 papers of Kaplan, which is available online and in different social media groups. Again, rectify your mistakes. After rectification of your mistake, go and practice E2 mock exam sample paper. These are also very helpful. Remember, if you are scoring 31 to 33 and practice papers, it means you are doing very good. If you are getting this score, then go back to the OET website and practice paper number 4 and 5 just before your exam days. Technique: how to overcome this sample papers technique and how to overcome the listening part and exam. Remember, the first and the foremost thing is to focus. Focus is the key, and aim for 21 to 22 marks in A part with the total marks of 24. Out of this, try to get 21 to 22 marks. This is very easily gettable. Now you will be given this sort of paper, and the exam, remember, starts early. You will hear an examiner talking to someone, and the exam, and at that time you will be wearing the headphones or listening through a speaker. Whenever they tell you to turn on the page, and you will hear the examiner saying extract 1. As soon as he says extract 1, do not listen this. You hear a gastroenterologist talking to a patient called Andrew Taylor. For question 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes. Now, while they are reading this from extract 1 to at the notes, they are almost consuming 30 seconds. So they will read this from this and 30 seconds, and what you will do in these 30 seconds, start reading from here. Andrew Taylor background had this effect of condition on everyday life. The moment you reach here, you will hear that I am the Andrew Taylor, a patient, and doctor will be asking how I can help you, Taylor, and then she will start telling his history. So till that time you have reached here. So these 9 MCQs will be very easy for you. Once the historian reach here, then go along with the history. This is very easy. Her experimental with excluding this, like whatever she says, or words, then she will say were slight reduction in caffeine intake that she had met, and go to the answer 11 again. Sometime it happen like there are two MCQs in one line, like claiming to be consuming sufficient, number 1, and number 2 MCQs. This is the point where you lose the historian and the doctor. Whenever there are two MCQs and one line, remember, focus on both at the time. Just like I am giving you an example that claiming, Andrew is claiming to consume sufficient coffee and saturated fats. This is the example I am giving. So during the exam, you might hear that Andrew Taylor is claiming to be consuming sufficient saturated fats. At that time, your focus might be here, and where you will lose these MCQs. Claiming to be consuming sufficient saturated fat and caffeine. This is very, very important point, and work on this. Again, part A is very, very easy, and it's easily gettable to get 22 out of 24 marks. Now coming to the part B, and this again you will hear a person or a historian talking or giving a history to a doctor or any medical professional colleague from here to here. Again, this will consume about 1 to 1.5 minutes. So don't focus on the above. Directly start reading your question and giving a quick glance at the answer. This will save your time. Once you hear question number 25, shift your focus from the question you are reading to question number 25 and then go with the examiner. Next is part C. Again you will hear two persons talking to each other. From here to here, again it's time consuming. Don't focus what they say. Focus, and this they might not say or mention that question number 21, 22. They will say it in question number, in part B, question number 25, 26, like this. But in part C they won't say. They will just have a normal conversation with each other, and you need to pick on that. See the question carefully. Before they read this portion from here to here, they will consume about 1.5 to 2 minutes. So in these 2 minutes, try to read all the 7 questions coming up next to you. Underline your question, that what does Sandra Morton sees in the main aim in her work, and identify the answer to inform patient about different treatments to publish the availability of test, and like this. Go to question number 2. Then you will hear suddenly that a specialist cancer nurse called Sandra Morton, who's talking about her work with the prostate cancer patient. Then focus from here will start. This comes to the end of this OET listening portion of the exam. Thanks for watching. If you really liked my videos, please like and subscribe. Thank you.